So your baby has bronchiolitis and your doctor has told you you don't need any antibiotics. And you're wondering, is this really a qualified doctor? Do they know what they're talking about? Why don't they want to give my baby medication? And you're just worried and your mind is just racing and you're very, very worried and you even want to sue this doctor. But imagine that is the best doctor for your baby. Because bronchiolitis is a viral infection. It's actually caused by viruses and doesn't necessarily mean that your baby needs any antibiotics. My name is Dr. Anviola Nalugala, and today I'd like us to talk about bronchiolitis and how we can help your babies, especially in this cold and flu season. So what is bronchiolitis? Most of the time, bronchiolitis will affect children under 2 years of age, and it's mostly caused by viral infections. In fact, you'll find that maybe you have a firstborn who is at school going age, and then your tiny baby keeps getting this flu and cold and nasal congestion. So how do these babies present? Most of the time, your baby will start with having nasal congestion. They might have a cough or a sneeze, and they might even have fevers. Fevers is what mostly brings our babies to hospital because our parents become worried. Because they're like, why is my baby getting fevers? And mostly associate fevers with infections. But remember that you can still get viral infections, and bronchiolitis is part of the viral infections. So how will your baby present? I will mostly talk about babies under 2 years of age because these are the most vulnerable groups, and these are the babies whom if they get bronchiolitis, it might end up being a life-threatening condition. So most of the times you'll find that your baby starts having like a fever here or there. They might start having a cough here or there. They might start having nasal congestion. And one of the major danger signs other than the fever is when the baby now starts having refusal to breastfeed, because most of our tiny babies really rely on fluids and feeds to maintain their status, their normal body status. So if you find your baby has a cough here, a sneeze there, nasal congestion here, don't be worried. You can just continue breastfeeding them. You can suction them a bit. You can give them some medication to relieve the fever, because those are the most common symptoms. However, something I would like most parents to really look closely at is the work of breathing. If you see that your baby is breathing really fast, you're seeing that your baby is turning blue, you're seeing that your baby is really working very hard to breathe. You can observe their lower abdomen and you see that they're really breathing deeply. I would really advise to bring your baby to hospital because these are some of the danger signs. With bronchiolitis, you'll find that the first 3 days are usually the normal days where your baby can have a fever here or there. They can have that sneeze, that cough. They can even have runny nose. Sometimes they might have conjunctivitis. But between the 4 and 5, that is usually the worst times of bronchiolitis. And at this point, you'll find that your baby, if the baby is working to breathe, they seem like they're really struggling to breathe, just rush them to hospital, because sometimes they might even need oxygen for management. And finally, after between let's say day 6, 7, the condition should be improving. If you find that your baby has been sick for at least more than 2 weeks, that is also a red flag, because it's not normal to have this bronchiolitis or flu-like illness for more than 7 days. By day 7, the baby should be improving and getting much better. If your baby was a premature infant, then this is not really something that you should ignore. A lot of premature babies get bronchiolitis and it can end up being life-threatening condition. And we even end up losing some of our tiny warriors who are NICU survivors just because of bronchiolitis. So it's really important to monitor closely your baby, especially the work of breathing, and especially if they are turning blue, and most importantly, if they have any form of refusal to breastfeed or refusal to feed. I really advise parents to be cautious, to come to hospital and be told to go back home than to ignore these symptoms and then you end up losing your baby. It's usually a very sad instance for not only the family, but also for us who have been walking this journey together with you. So don't forget, your baby might be coughing, that is okay. Your baby might be sneezing, that is okay. Your baby might be having fever here or there, that is okay. But if you've baby is having persistent fevers that is not resolving with exposure or resolving with paracetamol, please come to hospital. If your baby is having constant cough to the point that they're not even able to feed or breastfeed, come to hospital. And if you find that your baby is having increased work of breathing, or if you as a mom is just worried about your baby, come to hospital. We can even admit your baby just because the mom is worried, because you are the one who knows your baby more than I could ever know your baby. So if you just feel like you're off, if your maternal instincts are like, no, my baby is not okay, come to hospital, fight for your baby, and you will find pediatricians or residents who are working to be pediatricians like us who are ready to fight for your baby. Well, that is it for our 5-minute checkup. If you have any questions, please put them in the comments below. If there's any topic you'd like me to talk about or something you'd like me to expound more about, make sure to put them in the comments below and I'll be sure to reply to you. If you have any personal questions, also just slide in my DM, slide in the inbox, and I'll make sure that I answer you. That is it for today. Don't forget to like and hit that follow button.